Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonics Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
African Oriental Store Africa fii si biir America ñu ngi leen fi amal seasoning ak lépp loo leen nama biir Gambia diwtiir ak bagaas ndekki yi ngeen soxla canned beef African Oriental Store andil na leen ko si seen heavy boti ba tey it amal nañ leen netetu gerte noflaay yéet ndawal African Oriental Store nag mooy bitik bi nga xam ne lépp loo leen soxla mi ngi si biir amal nañ leen maalo leket tame inde andi cuuraay waaye it fàttewuñ suñ góor yi nga xam ne ni den tele seen néegi sëy yi African Oriental Store indi na leen garab goo xam ne ni dina leen delloo seen kàttan ba tey it ñu ngi leen amal abaya dàll abaya boo munti xalaat bu jigéen ñu ngi ko fi am waaye it fàttewuñ góor ñi amal nañ leen xaftaan ñi amal nañ toobaan cuuraay African Oriental Store nag bagage yi nii fépp foo nekk si biir Canada bi ak US di nga ko mun a am ndaxte ñu ngi leen amal shipping African Oriental Store Africa si America fii si Everett Washington njaaxare jeex na.
We are again here witnessing another important handing over of refrigerators to the Bristol Belt, which will finally end up at the National Blood Transfusion Services. And this is donated by John Hans to Save the Baby. The CEO, Madam Amijaju, who lives in the United Kingdom, who is also the CEO of this organization. And with that organization and the team, is supporting this initiative by providing refrigerators to the Bristol Belt. So we start the statement by the program manager of the National Blood Transfusion Services. Who will be the main recipient for these refrigerators as we get the work of National Blood Transfusion Services. Madam Mariama Jame, kindly come forward to give your statement.
Honorable Minister of Health, Dr. Samate, the National Assembly member for Sambala, all directors present here, staff of the Ministry of Health, colleagues and donors from Join Hands to Save the Baby, media, personnel and colleagues, say good morning to you all. It is a pleasure to give a statement on this very important handing over of blood bank refrigerators donated by Join Hands to Save a Baby through their CEO, Mr. Amijaju, who is based in the UK, as Modunja said. The donation is one of the many donations that SIG has done. These refrigerators are very essential in the healthcare system, particularly in the National Blood Transfusion Services. Ami, though she's based in the UK, has many times shown that her heart is still in Gambia. She is very, very committed to making sure that maternal mortality and maternal related deaths are as reduced as much as possible. And for that reason, she has taken up a project called the Maternal Blood Bank in order to contribute to the reduction of maternal mortality via ensuring that safe blood is available for mothers and babies at our health facility, and also for other patients who go through surgery and other medical conditions that need blood transfusion. Although most of her donations are done behind the scene, I will want to give you some of the efforts or some of the donations and other activities that she has done, and also show you her contribution to the health sector, particularly the National Blood Transfusion Services. Jaju, through her project, Join Hands to Save a Baby, has supported the renovation of the Mandinari Health Center, also supported the Brikama District Hospital Maternity Theatre project. She provided TVs with free satellite projects supplied to Mandinari, Banjulindin, Sukuta, Guru, and Jara Soma health facilities. She renovated and totally set up a neonatal unit ward room with 4 incubators at Liam Hospital. She supplied oxygen machines at EFSTH in Banjul and Brikama District Hospitals. Supplied blood pressure machines in many health facilities across the Gambia. She also supplied more than 20,000 baby clothes, starter packs, and hospital bed sets to various health facilities. Also, her initiative usually cook food occasionally and distribute across some maternity units within the country. Also, AMI has supported many blood drives and blood harvesting exercises by providing the logistics and materials needed, such as donor t-shirts, food and transport refunds for blood donors. And through that, we have harvested so many blood units that have been used to support patients in need, particularly women during labor. So she has initiated the Maternal Blood Bank Project, which was launched on the 24th of October 2020. This project was launched to support the National Blood Transfusion Services of the Gambia to help reduce the challenges of blood inadequacy in our health facilities, and also to help women and children who need blood to get safe blood transfusion in a timely manner. Ms. Jaju has spent over $1 million since the launching of the Maternal Blood Bank Project in October 2020. Today, we are here witnessing the handing over of 5 blood bank refrigerators from the same lady through her Join Hands to Save a Baby project to the Ministry of Health, so as to strengthen the blood transfusion services in the country. This donation could not have come at a better time because we have facilities that are in dire need of blood bank refrigerators. The total cost of these 5 refrigerators is above 500,000. Honorable Minister, ladies and gentlemen, these refrigerators are specially designed for storage of blood and no other product, and hence they are very expensive. They will be taken to key centers that are in dire need, such as EFSTH, Basse, Bansang, Birkama, and others. They will be used to store blood only and no other product, I emphasize. As blood bank fridges, if they are not available, blood could not be stored because the temperatures in these fridges are only designed to ensure that blood are kept as efficient as possible so that the efficacy is maintained. In ensuring that these fridges are put into good use, or before even procuring them, Mrs. Jaju has had many discussions with the National Blood Transfusion Services to find out what the needs of the country are in terms of alleviating or reducing the rate of maternal mortality associated to lack of blood or blood inadequacy. And that led to the procurement of these fridges. And I would like to take this opportunity to thank Ms. Jaju and her entire team for their commitment to support the Ministry of Health, not only in the National Blood Transfusion Services, but in other sectors, to ensure that patients who get to the facilities get what they want, are treated accordingly, and also get timely interventions. I want to assure Ms. Jaju and the donors, through our representatives here, that these refrigerators will be distributed accordingly, will be put into good use, and the usage will be monitored. So thank you, Mrs. Jaju, and the entire Join Hands to Save a Baby project. I still emphasize that there is more need for such donations. more of a time, through social media, you will see the plea for blood donation. There is someone in critical need for blood. It's not only giving blood that makes blood available. The logistics have to be there to store blood. If the logistics are not there, only limited blood could be stored. If you look at the refrigerators we have here, the smallest one here can store up to 40 pints of blood. And the biggest has a capacity to store more than 200 pints. So if our facilities have this blood and have consistent electricity that can maintain it, either through the NAVEC system or via a support, another support systems, then at least there will be facilities to store blood continuously, and that will also help reduce the lack of or the shortages of blood in our facilities. In this regard, I would want to urge all other philanthropists and donors to embrace Ami's efforts and her team, to embrace their efforts, and also come forward to support the National Blood Transfusion Services, because we all know how important that unit is. We all know how important, because always we see people crying or pleading for blood donors. A lot of efforts have been made, but it's still not enough to ensure that we have continuous safe blood in our blood banks for the entire nation. So I urge everyone to come forward and support the services, just like Ami did, and also encourage any other person outside that we know that can help the services to ensure that our patients, particularly mothers who come to give birth, get transfused in a timely manner whenever it is required. I thank you all for your attention.
Thank you very much, Madam Ajame, the program manager for National Blood Transfusion Services. I now invite Mr. Abdullah Jaju. Today is the day of Jajus, and Jaju, Abdullah Jaju, and Honorable Sefa Jaju. So we have Abdullah Jaju to come and give a short statement, and then followed by Honorable Sefa Jaju.
Good morning, Honorable Minister of Health and Social Welfare, Dr. Ahmed Lamin Kamat, the Director President, Director of Health Services, Deputy Director of Health Services, the Honorable National Assembly Member for Sumbala Ward, Honorable Sefu Bajaji, Program Manager, National Blood Transfusion Service, Deputy Program Manager, National Blood Transfusion Service, National Coordinator of Joint Hands to Save a Baby, Mr. Abdullah Baji, members of the press, staff of the Ministry of Health and Social Welfare, ladies and gentlemen. We are gathered here today to witness the official presentation of 5 blood bank refrigerators worth more than $500,000 to the Ministry of Health and Social Welfare, courtesy of Joint Hands to Save a Baby. Just a reminder, Joint Hands to Save a Baby in her quest to complement the efforts of the government in the fight against maternal mortality in the country, has launched the Gambia Maternal Blood Bank Project some time ago, to be precise 24th October 2020. Since then, Joint Hands to Save a Baby, in conjunction with the Ministry of Health and Social Welfare, has been engaged in a series of activities to prevent maternal death resulting from unavailability of safe blood transfusion. The Foundation has conducted several blood drives in support, with the support of technicians from the National Blood Transfusion Service for storage in various hospitals in the country. We believe that these refrigerators will be of great sense in the aforementioned fight. There is no doubt that the project is making significant impact on many lives in this country. As this has been the mantra of Joint Hands to Save a Baby, to impact positively on the lives of the less privileged, particularly women and children in the Gambia. We hope to continue working closely with the Ministry of Health and Social Welfare so as to realize our common interests with support from partners and other stakeholders. The foundation has spent considerable amount of resources from the start of the project till date. But we are pleased to have a founder who has great pride for women and children of this country, who is no other person but Madam Abijaju. She is practically not with us, but then she has always been a lead pathfinder in all our endeavors. From the beginning of the project till date, in total, Joint Hands to Save a Baby has spent $1.16 million from the start of the project till date. On behalf of Joint Hands to Save a Baby, I would not do justice to this convergence if I fail to recognize the support of certain bodies as well as individuals who has been very supportive in this crusade, namely GK Partners. GK Partners have been very instrumental in the implementation of this project. GK Partners has donated over $200,000, which was part of the purchase cost of these refrigerators. The midwives and mothers have also been very supportive. They've donated $10,000 at the beginning of the project. Hot and Fit has also been very supportive. And we have some other various personalities who are also very supportive to the project. Mr. Babu Sala, Susan, Maria Sol Baji, we are also very, very supportive. And we have Madam Sejalo, who provided PPE equipment at the launching of the project. Of course, we are not forgetting the Gambia Armed Forces. They've always been our support in our quest to ensure that there is safe blood for transfusion in our hospital. But we would also like to recognize the contribution of the National Blood Transfusion Service. They have been very, very supportive. They are always rendering service to us whenever and anywhere their service is needed. Madam Sophie Abia, words can't describe enough about how we are grateful to you. Madam Abi Sophia is somebody who used to amaze us as a result of her dedication to duty. She has been a very good source of inspiration to us. So Madam Sophie Abia, we are thanking you with your entire team. And finally, Team Joint Hands to Save a Baby. Starting from our national coordinator, Mr. Abdullah Baji, the founder of the organization, and also some other members of the organization, and also Team Joint Hands based in the UK. They have been very, very supportive to this project. We have among us Mariama Balajo, who has been very supportive and a midwife at Banjul and Center. Maria Masala, who is our able PRO, and the rest of the team. So on that note, I am very delighted, and I thank you all for your audience.
Thank you so much. Thank you very much. I was trying to say, but I think also the Ministry of Health also created or provided an enabling environment for the Joint Hands to Save a Baby to be operated in the country. Because we know that the minister could not attend the launching, but was able to delegate someone to attend the launching on his behalf. So I think we also have to thank the Honorable Minister for the support he has also led to ensure that this initiative moves on. So Honorable Minister, thank you very much. And now invite Honorable Sekou Bajaju, who is also the MP of my area where I am. So Honorable Danny.
Thank you very much. Alhamdulillah Rabbil Alamin. Alhamdulillah Rabbil Alamin. Honorable Minister, I agree with you. The director here, the sun is hot. I want to make it very short. My role today is to give a statement as a family member. I mean, it's a sister. But I want to challenge this Sanya Kundangas because the Director of Health Promotion says, today we have a family of Jaji Kundas. We are happy today to present materials worth of over $500,000. So I'm challenging the Sanya Kundangas also to come up to do a presentation let's say. Honorable Minister, AMI is a family. I want to put to the audience and the ministry how comes AMI as a Gambian got this idea to do this sort of project in the Gambia. Some time ago in 2012, 2013, AMI went to Brikama Health Center to visit, to see a brother's wife deliver baby. When AMI went there, AMI found the condition, the nurses, the midwives, and the babies and the mothers in that labor was not appreciative to her. Then she asked herself what she could do, which recalls her mind to the quotation of the former president of America, John F. Kennedy, what can you do for your country, but not ask what your country can do for you. So when AMI went to that hospital, she felt so bad that the midwives, the nurses, the mothers, the babies who are born, who are very vulnerable, doesn't deserve that sort of environment. So she went back to UK, mobilized fund, and then came up with this project to say, let's join our hands and save babies. So as been alluded by the Madam, the first speaker, those are some of the series of programs AMI is doing. So she, for that being the case, because she got her inspiration from Brikama, she built a fully fledged theater at Brikama so that she can save mothers. So today she is here to donate this one also. How comes she also switch her activities from maternity to blood bank? Honorable Minister, there was some time ago in the country, there was this outcry in the public, in the social media, that mothers are dying during labor. So AMI she even asked me, what can I do? It's going to be a joint responsibility. The Ministry of Health needs to do their job, the mothers themselves need to do their job, the hospital needs to do their job. She asked me, what can I do? And then she came up with this idea. Probably there might be shortages of blood in the hospitals. That could also lead to the passing of our mothers on labor. Then she came up with this one. She launched a project, a blood bank, and then she also, through her consultation with the experts, she realized that the hospitals also need a preservation facility to preserve these bloods. So that's why she mobilized this fund, over $500,000, to present it to the Ministry of Health, to forward present to the health facilities that need them, so that when bloods are transfused, they can be kept safe in the hospitals for mothers and babies that need them to use at the right time. So that's why we are here today. So I want to urge, as I said, I want to urge every Gambian, because if every Gambian is like AMI, there will be little tears on the vulnerable people in this country. The government do theirs, citizens do their job. If I tell you how AMI gets this money, you will be surprised. In the Gambia here, it's going to be a very big surprise to see a woman driving a truck. I've been to UK, I visited AMI in her house. Very rare. I spent 4 days with her, but there has never been a time you say each other good night, because she goes to her bed, I go to my bed. No. All the time, AMI is up. AMI comes at a time when everybody is sleeping. What does he do? She goes and organize programs to raise funds, to make sure that she does something for the country. So that's why I'm saying, if every Gambian out there is like AMI, there will be very little tears on the faces of vulnerable people. So for that being the case, I urge every Gambian to emulate AMI and contribute whatever we can towards development and the safety of our people. So on that note, I thank you very much.
Thank you very much, the chairman of the occasion, the Director of Health Promotion and Education, Mr. Njai, and your entire team for organizing and coordinating these presentations this morning. Thank you. The National Assembly member for Busumbala constituency, our own brother, a friend of the health sector, Honorable Jaju, we welcome you. Thank you.
Thank you.
The Director of Health Promotion and Education, the Director of Health of the Ministry of Health, the Director of Health Services, Ministry of Health, the Director of National Pharmaceutical Services, and all of you with your entire teams, the Program Manager, National Blood Transfusion Services, Madam Mariam Jane, and your able sister and support and assistance, Sophie Abia, for all the running around and the passion you put in this. But our guests, our donors, join hands to save a baby. You are the special guest today. We are delighted to receive you here today to be part of the strategies of the Ministry of Health. We thank you for spending your morning with us, but not just spending your morning with us, for providing these life-saving materials. Blood fridges are as life-saving as any other hospital equipment. Traditionally, that we say are life-saving equipment. Honorable member, distinguished ladies and gentlemen, blood is a very important part of the human body. Without an adequate amount of blood in our systems, we encounter problems. In fact, when the blood level goes low to certain extents, people lose their lives. So that is why making sure that there is enough blood in our health facilities is a very, very important step in the healthcare management services. We realize that a lot of people need blood in the hospitals. People with anemia due to various causes need blood. But one striking one is the people who acutely need blood, those who have gotten a quick loss of blood, either through injuries or either through delivery. When women go into labor, they lose blood. Sometimes the loss of blood is quite a lot, that it is not even compatible with life. So at that point in time, blood needs to be given back to these women urgently, very, very urgently. Now this blood needs to be available. So, honorable member, distinguished guests, problems associated with loss of blood in women who have delivered or around delivery is the second most common cause of death of women in the Gambia. So, peripartum hemorrhage, especially after they've delivered, postpartum hemorrhage is the commonest cause, is the second most common cause of death in women in our health facility. So when we talk about maternal mortality, of course at this juncture, I think it's another opportunity to talk a little bit about maternal mortality. Maternal mortality is high in many developing countries. The loss of a single mother is sad enough, talk less of if it's more than one. But as a country, maternal mortality has been declining in the Gambia over the period, even though it is high, but it is going down. The Gambia's maternal mortality ratio is one of the lowest in the sub-region as we speak to you. But we say to ourselves, we don't want a single mother to die because of pregnancy. So we have to put all hands on deck, inshallah, to ensure that that happens. The cause of death in many women is multifactorial, many factors. But hypertension in pregnancy, when their blood pressure rises, that tends to kill quite a number of women in pregnancy. Loss of blood, prolonged labor, other causes, even diabetes in pregnancy and their complications and so on. So these are very important. When women also delay in presenting at the hospital, these complications become more likely. So the factors are many. Now, when we get blood fridges, it complements government's efforts in dealing with the availability, to ensure availability of safe blood in our hospitals. So today we stand here and recognize the immense contribution of our sister Ami Jaju. Ami has been working very hard, as mentioned by the Honorable Jaju, behind the scenes, quietly, working a lot behind the scenes to provide support to the health sector. You mentioned quite a number. I've been aware of quite a number of these. In fact, at the hospital, she had collaborated, EFSTA, she had collaborated with the First Ladies Foundation to donate oxygen concentrators. I was at that occasion, and we are certainly grateful to Ami.
Thank you so much.
But we say to Ami, you are, as they say, walking the talk. And Ami is not even talking much.
Thank you.
She is just doing the work. Yes, it is important, Honorable National Assembly member mentioned, what can we do for our country? Not what our country can do for us. He quoted, Gambia is a poor country. We cannot pretend that Gambia is a rich country. Gambia is a poor country. So because we are poor, we don't have all the resources. Now, if government had gotten all the resources, Gambia would have looked like a first world country. It would have looked like America or one country in Europe or Asia that's well developed. Because that's what government would have wanted, to make Gambia beautiful and functional, things to be functional. But without resources, you cannot do this. These are the problems of poverty. So if citizens realize that Gambia is a poor country, yes, government has its role to play, but citizens also have their role to play. Because we have a poor country, so let's complement government's efforts to make sure that we move the country forward. Now, Ami is doing just that. Yes, we hear some people say Gambians' life matter, women's life matter. Yes, we agree to that totally, because that's why we are having sleepless nights. The team here, you can see, some of them sleep few hours each day. The entire team in the Ministry of Health, people sleep, and our partners. This is a volunteer standing right here. He's going to school, but he comes in here to sacrifice his time. And we have many volunteers like him. He's been here since the COVID pandemic. In fact, he was calling me day in and out to ensure that he gets, in fact, I remember having to call Mr. Njai many times, say Ibrahima wants to participate with his team, make sure they come. And he's been here every day since then. And we thank people like him very much.
Good.
But rather than just being on the social media and complaining and criticizing, criticism should be positive. But before we go to media and say something or write something against government or against the Ministry of Health and so on, I think the first question is, we ask ourselves, what am I doing for Gambia? If we ask ourselves, what am I doing for Gambia? If we are doing something for Gambia, then we can say, yes, it's justified to go and be criticizing. But if your answer to your question is, I'm not doing anything for Gambia, then you better go and start doing something for Gambia. Because the Gambia belongs to all of us. Each point in time, there is a government, there are officials whom Allah had put there to run the affairs of this country. This is life. And they are doing our best. We are doing our best. But for people like Ami, we say you are doing a lot for Gambia and helping the health sector. The truth of the matter is, we simply do not know who is going to benefit from these fridges. Who is going to need the blood that is going to be stored in these fridges? Nobody knows. We don't know. It could be any of us. We pray it is not, but it could be any of us. They are not just for pregnant women. They are for people who could have been injured in an accident. It could be for people who would have vomited out a lot of blood and they need blood transfusion. So when we support the health sector, we are supporting ourselves, and the blessing of supporting the health sector is limitless, because each person whose life is saved because of Ami's efforts, you can imagine the unlimited blessings to Ami, her entire team, of Joint Hands to Save a Baby. Honorable, all of you, for all your efforts in this. But we must say we thank Honorable Jaju very much. This is not the first time he's participating in this. You have seen him on TV recently, coordinating the donations. He's always talking to partners and telling them we need to support the health sector. If he sees things that need to be improved upon, he's one person who doesn't hesitate. He calls me and says, Honorable Minister, I saw something here. You need to do something about it. And I say, thank you for informing me. We'll deal with it. He's like that. He doesn't hesitate to point it out when it needs to be improved or when it is not going right. But he stands his ground to make sure that there is support for the system. This is leadership. This is good leadership. So we thank you, Honorable, for all your passion.
Thank you. Thank you.
To Mariama again and Sophie and your team and your director, the National Public Health Laboratory, it has been a tough period, especially during the COVID-19 pandemic. But believe me, your contributions have been recognized by the government and the people of this country. And together with all the participants who have been working hard during the COVID-19 pandemic, and also in your efforts to continue the provision of essential services even during the COVID-19 pandemic, because other diseases also continued. So we thank you all for all your support. Thank you. I want to close by thanking all the media personnel, all of you. You've been there throughout. Believe me, without your support, without you being there, without your coverage, without sending these messages across to the people, our efforts wouldn't have been accomplished. We wouldn't have been able to reach the people. The people wouldn't get the messages that they need to get, because healthcare service delivery, the message has to get to the people. Without the message, the right message getting to the people, you can't help them. People care about what they know. If they don't know about what they need to do, they cannot help themselves. So we want to use the opportunity to close by thanking all you media personnel. Thank you very much.
Thank you. Good afternoon, Honorable Minister. Good afternoon, the Honorable Sekuba Jaju. And I will say good afternoon to all the people who are present here. This is going to be a short one. I think this one is very hot and it has been a long day. But I'll just say I'm very much delighted to be given this opportunity to give a vote of thanks on this auspicious occasion today. I think a lot has been said by Madam. A lot has been said about Madam Jaju, but I think Madam Jaju has expressed her patriotism as a Gambian and as a lady. That shows that what a man can do, a lady can do, or a woman can do. Okay. So her efforts are highly appreciated. On behalf of the Ministry of Health, I would say that her efforts are highly appreciated, and we thank her very much, and then the rest of her team. As I said, this one is very hot, so I thank you all very much. Thank you, sir.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland, and the rest of the world, Supersonics Money Transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonics Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
African Oriental Store Africa fii si biir America ñu ngi leen fi amal seasoning ak lépp loo leen nama biir Gambia diwtiir ak bagaas ndekki yi ngeen soxla can beef African Oriental Store andil na leen ko ci seen heavy boti ba tey it amal nañ leen netetu gerte noflaay yéet ndawal African Oriental Store nag mooy bitik bi nga xam ne lépp loo leen soxla mi ngi ci biir amal nañ leen maalo leket tame inde andi cuuraay waaye it fàttewuñ suñ góor yi nga xam ne ni den tële seen néegi sëy yi African Oriental Store indi na leen garab goo xam ne ni dina leen delloo seen kàttan ba tey it ñu ngi leen amal abaaya dàll abaaya boo munti xalaat bu jigéen ñu ngi ko fi am waaye it fàttewuñ góor ñi amal nañ leen xaftaan ñi amal nañ toobaan cuuraay African Oriental Store nag bagage yi nii fépp foo nekk si biir Canada bi ak US di nga ko mun a am ndaxte ñu ngi leen amal shipping African Oriental Store Africa si America fii si Everett Washington njaaxare jeex na